Essai 1, 2, 3. Essai 1, 2, 3. Essai. Essai 1, 2, 3. Essai 1, 2, 3. C'est bon. Bonne chance au pile. Essai 1, 2, 3.
Test 1, 2. Test 1, 2. Ouais. Challenges.
Guiding principles situational analysis. Good morning, ladies and gentlemen. On behalf of the Mauritius Research and Innovation Council, let me welcome you to this session on health and wellness innovation. In fact, this session on health and wellness is being held in a broader context. As you might be aware, the MRIC is developing a roadmap for innovation for the next 5 years, and we have identified a number of thematics a number of priority thematics to be taken on board in this exercise. So these 6 thematics consist of blue and green innovation, health and wellness, financial innovation, social and grassroots innovation, travel, tourism and entertainment innovation, as well as IT and emerging industries. Now, the roadmap is not going to be confined to these 6 thematics. These are just the 6 themes that we are starting on, but of course, as we go ahead, we are going to enlarge the scope of the work. Now, this particular group is on health and wellness. And health and wellness, ladies and gentlemen, is a very wide sector. It was quite a challenge for us to start the consultations for this particular sector, as it consists of health, human health, but as well as wellness, which is sports, yoga, meditation, much, much, much larger than what we think. Now, to do so, we set up a committee comprising of a wide range of stakeholders. They are all listed on the screen. So we have public sector, ourselves, MRIC, Ministry of Health, Ministry of Youth, Ministry of Industry. We had the EDB, Ethics Committee, the Clinical Research Council. We had academia, University of Mauritius. We also had a range of private sector actors, the Mauritius Multi-Sports Infrastructure Limited, APCODO, Axonova, Polytechnics, CAP Research, CIDIAM. So this is just a group of the actors, which we started to meet on the 15th of February until the 11th of April. We had 5 meetings in all. And we came up with a paper, a report, which we are going to present to you today. And as today we have a wider range of stakeholders, we would like the second part of this session to be very interactive, where you will be asked to ask questions to tell us what you think on what we have done so far. Now, what did the committee do during these 5 meetings? We defined the scope of our work, the aims and objectives. We did a situational analysis of this sector in Mauritius. So we sort of developed a national vision. We looked at the opportunities, at the gaps and challenges, which are going to be presented a bit later. And we also looked at international trends because, ladies and gentlemen, the wellness industry is a $4.3 trillion industry, and this is something that Mauritius could tap into. So we also looked at international trends, and we looked at both research and innovation in the healthcare. And we came up with some broad strategic directions, which are going to be presented later. Now, we couldn't do everything in that sector. We couldn't go over everything that is health and wellness. So we had to define a few sectors based on national priorities. These are the medical sector, the life sciences, the healthy lifestyle, which is sports and nutrition, and high value activities such as high-tech medicine, healthcare tourism, medical education, silver economy, which all figure on the government program and different strategic plans of the country. And the overall aim of this work is to strengthen capacity for a integrated, coordinated, and collaborative research and translation into policies, improve products and services. Now, before I finish, I'll just present to you some of the national documents which we consulted. We consulted the National Sport and Physical Activity Policy, the Health Sector Strategic Plan, the development of a nutraceutical framework and industry in Mauritius, a report which was developed by EDB, industrial policy and strategic plan because of medical devices, the government program, which has a number of measures on health, the budget speech, and also all the emerging sectors for investment on the EDB website. Now, I'm going to stop here because in the first part of this program, we are going to have a presentation of the report by Dr. Gita and Dr. Boulay from EDB and Axonova. And after that, we'll have a tea break, then we'll come back for a paneling discussion by industry champions from both public and private sector before the interactions. So I will now invite Mrs. Gita from EDP to present the first part of the report. Mrs. Gita, please. Thank you.
Thank you very much, Dr. Madhu. Good morning, everyone. And it's a pleasure on behalf of the EDB to be present here and to address you and also share the work of the technical committee on health and wellness And as you can see, there's quite a wide range of stakeholders and wide range of activities also that are being done at the level of the health and wellness, having on board the well-being of the. So in terms of the Health and Wellness Technical Committee, there were 10 priority fields that were identified. That ranges from the clinical research to life sciences, pharmaceuticals, vaccines, and also taking on board the medical devices, nutraceutical industry, and also developing a sports innovation ecosystems. So I go briefly about all the different subsectors and also key issues. How I presented it is in terms of the enabling environment, because you need to have an enabling environment to encourage more investment, to encourage the development of these sectors, and also how these can impact on the economy. So definitely in terms of the clinical research, one of the key areas and very promising sector for Mauritius, and we have all witnessed that during the pandemic, how clinical research and clinical trials is important. So definitely we do have a Clinical Trial Act. We have the structured approach for the issue of a clinical license, trial license that is issued by the Clinical Research and Regulatory Council, and all the other ecosystem that has been put into place. Definitely, Mauritius, we have a multi-ethnic population that adds more value for the conduct of clinical trials. We have different prevalent diseases also where we need to have more clinical trials that would benefit the population, development of clinical research, linking it with the Ministry of Health and also the cancer sector. So that is also the cancer research part of it. How can we do that? So what were the key challenges is, yes, we have to look at the full value chain. In terms of the preclinical trials, this is also something that is being put forward and that would have to take on board because we have to look at it in a holistic way. And also in terms of the resources that have to be given to the Clinical Research and Regulatory Council to empower them better, to be more efficient, and also to take on board new clinical trials, because as you can see over the years, there has been quite an evolution in terms of clinical trial in Mauritius, in terms of starting for the cosmetics part of it, and now we're also doing vaccines, also testing that is being done. So definitely in terms of the second segment that we have is the medical devices manufacturing sector. We do export nearly 1.6 billion of medical devices in Mauritius. The export sector over the last 2 years, despite the pandemic, has increased. The increasing importance of manufacturing in Mauritius, and Mauritius is one of the top providers of catheters to internationally. So we do have a enabling business environment, again, with the market access with COMESA SADC, the region, incentives provided by the government in terms of a refund on air freights. And also this is high on the agenda of the industry in terms of how can we further improve on this sector and get more people to work on that. So definitely the demand is there, and the challenges are in terms of the Mauritius do import lots of medical equipment. So where is it? How can we further encourage more investment in these sectors? Currently, we do have medical devices manufacturers in Mauritius. In terms of the nutraceutical industry, which is very nascent, we do have one company that is currently manufacturing the nutraceutical segment. We do have, as already pointed out by Dr. Madhu, a report that has been worked out. We do have definitely the nutraceutical potential that has been identified through this report in terms of what are those products, that is the moringa, papaya, and all that can be used for further preparation of the nutraceutical products. So here also the part of the regulatory and legal framework is being worked out, and I mean needs to be developed, but that is also being done in consultation with the pharmacy board. Wellness and tourism industry, this is key because Mauritius being an island economy, so we do have the sand, sea, everything. So why not get all the tourism, the medical tourism aspect to work on that? And definitely we have specialized centers that offer definitely different verticals in terms of dentistry, cosmetic surgery, and other sectors. So definitely we have to come up with new ideas, new treatments, focusing on precision medicine, and also in terms of opening up more for super specialist doctors to come to Mauritius, train our people, and also establish the new framework. There was one discussion in terms of the public sector also could offer medical tourism develop further the medical tourism framework, because we do have different treatments that are being done at the level of the public sector as well. In terms of medical education, we can't go by without having the medical education component. So definitely the government is coming up with a teaching hospital. We do have to continuously upgrade our skills and competencies for the people in Mauritius, new medical schools, and also how can we better develop the capacity, the skills and competencies of the local population as well. I mean, we do have the ministry, the University of Mauritius providing the degree also in collaboration with the Ministry of Health also for improving the healthcare system. So there are some schools already, but then we have to capitalize more and how can we focus more on providing the skills and competencies for medical practitioners and upgrade the skills and competencies in Mauritius. Developing a sports innovation ecosystem. Definitely everyone needs to be part of a well-being system. Everyone has to do exercises. So definitely here also the enabling environment the government has put forward, and there's some key actions that are being done in terms of how to encourage more people to have to do physical exercises, the diet that goes with that. So no gâteau piment, no daiquiris, things like that. So we have to bear that in mind also, and also how best can we work on being more conscious about our diet, but also to do the sports and physical activities. So definitely here we do need to have a national framework for that, and also to work more towards the active sport island for Mauritius. In terms of the Ayurvedic and other traditional medicines, which is key because there's growing demand for that also internationally. So we do have the legislation. We do have an academic chair for the Ayurvedic medicine hosted at the University of Mauritius. The MOU is there. The recent visit of the Prime Minister also to India provides the interest for Ayush to be taken on board. So here also it is an opportunity, a challenge also. How can we have more focus on the traditional and Ayurvedic medicine that could be brought in Mauritius? In terms of the different issues organized, identified in terms of the non-communicable diseases also, there are bills that are underway. There's also the issue that we have to focus on the diet and nutrition, but also have more digital technologies that has to be put on place, because we do have key issues in terms of obesity and also in terms of the research that has to be done on different non-infectious diseases and also non-communicable diseases. In terms of the life sciences sector, so you have heard a lot about the development of the pharmaceutical industry, how we are going to encourage more pharmaceutical companies to come and set up in Mauritius. There's an already identified area in Rosebel to encourage more companies to set up in Mauritius, manufacture and then export, and also provide for the local consumption. The legal framework and the ecosystem is there. The government has announced the establishment of the Mauritius Institute of Biotechnology. There's a host of incentives that are being given to potential manufacturers also. But then we have to go together with academia. We need to have the skills for the manufacturing. The market definitely is small for Mauritius, so we have to go out and produce for the region. So these are the skills gap here do exist, but as the industry will grow, the skills gap, everything has to go together with that. So basically, these are some of the issues that has been discussed at the level of the committee, which we put forward to you for discussion and to get your feedback on the different priority lists that has been identified. I thank you very much for your attention, and I pass it on to Dr. Boulay. Yeah, thank you.
So good morning, everyone. So I am Dr. Fabien Boulay, CEO of Axonova. For those who don't know us yet, we are a laboratory based in Mauritius. We provide services, research solutions and services for the pharmaceutical, nutraceutical, and biomedical industries. So first of all, it's a real pleasure to have been selected by the MRIC to be the spokesperson of the Health and Wellness Committee and to present you the strategic orientation regarding health and wellness innovations. And I have to say that it has been a real challenge because it was a group of people coming from really different background, different subfield of the healthcare industry. We were representing all the stakeholders of the industry, including the public sector, ministries, government, business facilitators, also the private sector, clinical research organization, preclinical research organization, ethical committees. So it was a really diversity of people, and we had to really brainstorm and try to see to have a common proposition and vision on what could be the strategic orientation for this sector. So basically, we have come up with 4 strategic orientation that has been broken down in several thematics. So I'm going to go through all of that. The first strategic orientation is about promoting innovative technologies and practices. So we have broken this down in 5 thematics, as you can see. The first thematic is about green energy for the healthcare sector, because it was noticed, for instance, that in the national hospitals in Mauritius, there is a very big expenditure in terms of electricity and petrol, several hundred of millions rupees every year. And we believe that by changing the kind of source of energy, shifting to more sustainable energy, we could save a lot of costs regarding those expenditures. The thematic number 2, which can also be regrouped with thematic number 3 and thematic number 5, it's about telemedicine and e-health, which is something lately, I would talk globally, which is something developing very rapidly, and it's becoming something very trendy worldwide. And we think that Mauritius is lacking behind in this sector. And it would be good to take some initiative, for instance, to create some call centers for online consultation, to create a national database for NCDs, and also to just create application to promote access to sport facilities, personalized nutrition, fitness and wellness application, plant-based protein application, or just healthy nutrition applications. So the outcome that such strategic orientation could have is first the implementation and expansion of digital health technologies in Mauritius, adoption of other innovative technologies and practices to support the health and wellness sector, saving costs on electricity and petrol bill at the Ministry of Health and Wellness, but not only, can be also at the private sector, improve delivery of services in public hospital, a better provision of care, research, support, including preventive measure for NCDs, promotion of multidisciplinary conversation between hospital and private clinic and specialties hospital, promoting intersectional approach between major national hospital, private clinic, and medical NGOs. So that was for the first orientation. The second orientation is about harnessing the potential contribution of new fields in the health and wellness sector to contribute to the economic growth. So here we have come up with 4 thematics. The first thematic is about higher medical education. We all believe that to build an ecosystem in Mauritius, medical education should be the stepping stone. And that medical education also should be a prerequisite for medical tourism, because it can attract a lot of students from abroad and create some foreign currency coming to the country. The thematic number 2 is about Ayurvedic medicine, which is also a topic becoming more and more important in Mauritius and throughout the world. We believe that today Mauritius has enough capabilities to start building its own pharmaceutical plant to produce Ayurvedic medicinal plant in Mauritius to be able to cater for Ayurvedic patients and Ayurvedic clinics. We recommend the inclusion of Ayurvedic diet and lifestyle already at school level to offload the NCD burden in the future generations, and also conducting observational studies on specific illness, diseases in different Ayurveda clinics. And last we suggest as well to design and deliver a certificate in Panchakarma, which is a method in Ayurvedic to detoxify and purify the body. The thematic number 3 is about the promotion of a nutraceutical industry in Mauritius. Actually, Mauritius, when it comes to nutraceutical, has a lot to offer because we have a lot of plants that are unique to this region. And it's important that Mauritius build its own pharmacopoeia so industry can use this pharmacopoeia to develop products for use in Mauritius, but also worldwide. And last, it's about promoting a wellness industry in Mauritius. When we say wellness, it's about promoting physical and mental well-being, healthy lifestyle, nutrition, spa, meditation, spa retreat. This can also contribute to not a medical tourist industry, but a wellness tourist industry in Mauritius. The potential outcome, the expected outcome for this strategic orientation are research and innovation to promote Ayurvedic medicine, sport economy, silver economy, healthcare tourism, and medical education. Direct and indirect income from foreign student fees, hotel, parents visit. Hotel occupation rate during down season can go up, such as food and restaurant, transport, education material, leisure facilities. Mauritius to improve working relationship with various African countries throughout various scholarship deserving African candidates. Also air travel associated income with students coming to Mauritius. Mauritius can be the top wellness tourism against NCD throughout Ayurveda, preventive and curative medicine. And also evidence-based Ayurveda against NCD can be fine-tuned to the Mauritian context and applied. And finally, it will lead to improved services delivery by the Ayurveda physician and therapist. The third strategic orientation is about innovating for a healthier population. Here we have come up with 6 thematics. The first one is to improve diet for different strata of the population, for instance, athlete, student, general population, by creating mobile app, by communication, sensitization, awareness campaign, which is very important to give information to the population. Also, innovative performance nutrition in sport, where athlete can be considered as a role model. The thematic number 2, it's about sensitization campaign on healthy diet and lifestyle, which is very important because Mauritian has very bad eating habits, and awareness to the general population, sensitization is very important to change those habits. The thematic 3 is about creating a legal framework for nutritional labeling. Here again, it would be important when a consumer buys a product that he knows when he buys a product, which is the kind of Nutri-Score on this product, whether it's something good for your health or not good for your health. Thematic number 4 is about improving the lifestyle and health status of the elderly. Mauritius has an aging population, and it's important to create some residential homes, for the elderly. The thematic 5 is about addressing non-alcoholic fat liver disease and non-alcoholic steatohepatitis, which are serious disease, often not enough considered in Mauritius or underdiagnosed. And the thematic 6 is about addressing NCDs and infectious disease, especially throughout research on obesity, diabetes, or diseases that are very prevalent in Mauritius. So the expected outcome of this strategic orientation number 3 is addressing communicable and non-communicable diseases, addressing mental health, ways and means to reduce substance abuse, a decent living environment and aging with dignity and respect, participative incentive of patients in their own treatment, health literacy, proper adherence to treatment, impeding or delaying chronic complication, increase conversation between actors in formulating individualized treatment plan, and enhance health outcome for the senior citizen, better management for senior and geriatric issues, and impacting the diet behavior of the youth by using the athlete as a role model. So the last strategic orientation is more about governance and building the legal framework, because this industry, the healthcare industry, and especially the subfield of the healthcare industry, is a growing industry in Mauritius. And we need a more, well, first to build the legal framework or to improve the current legal framework to be able to innovate better and faster. So the orientation is about innovative governance mechanism to improve delivery of institutions. The thematic number 1 is about improving on existing framework to promote innovation in health-related institutions. For instance, the implementation of a clinical and regulatory framework for teaching hospital in Mauritius. The thematic number 2 is about upgrading the ecosystem for clinical research, including training and awareness. The thematic number 3 is about facilitating commercialization of research, especially regarding medicinal plant, where there's a lot of research that has been done for more than 30 years. However, the legal framework today don't allow the industry to commercialize those data. So it's important that we develop a framework for the implementation of the Nagoya Protocol in Mauritius. And the last thematic is about exercise, prescription, and referral to fight non-communicable diseases. The expected outcome for this last thematic is about institutional framework for teaching hospital, integration of public hospital into healthcare tourism. The postgraduate training of doctors need an appropriate clinical and regulatory framework, better and professional environment for clinical trials, putting Mauritius at the field with international standards, move from research to commercialization, and generate revenue for more than 20 years of accumulated research data. Attract overseas investors such as food, pharmaceutical, and cosmetic companies to come to Mauritius. Bring new opportunities for small planters, farmers, and owners of sugarcane field for cultivation of endemic medicinal plants. Competitive edge of having unique genetic resource, especially medicinal plants that exist nowhere else on the planet, and penetrate a fast-growing global nutraceutical market expected to reach more than $486 billion in the next 3 years. So that was the 4 strategic orientation. And on top of that, I would like to finish with this slide because there was also some general recommendation which are very important to move forward with this sector and to innovate. So the first one was about research and innovation and communication. I think communication is very important and essential in promoting health and wellness to the public. So sensitization campaign, awareness, communication, it's really a critical point. Then the second point is about IP. Because when we talk about innovation, we talk about intellectual property most of the time. And it's important that an IP legislation should be programmed in Mauritius, because it's important that when you invest in research, you can protect your findings and your inventions so as not to be copied by your competitor or by other institutions. Also, ethics committee and research and regulatory committee should be empowered. A high-level platform consisting of all ministries also should be set up to overview the whole sector. And finally, I would say probably the most important part, it's about funding, because when we talk about research and innovation, we need money, we need funding. So I think it's important that we have a good funding mechanism to help either company, private sector, or public sector to innovate faster and better. So thank you for your attention.
Thank you, Mrs. Jita and Dr. Boulay. I think we finished a bit early. I was expecting this session to finish at 10:15. Tea is not yet ready. So for the next 10 minutes, we'll try to do some work. Well, I'll just add in a few things to what Dr. Boulay and Mrs. Jita just said. Two of the fundamental things which we found to be very important during our exercise were public-private partnerships, which seem to be lacking throughout the pipeline. So this is something where we intend to put a lot of stress. And the second one is communication. A lot of research is being done, a lot of data is being collected, but it seems that this is not being communicated to the public. And health is something which touches the public. So we intend to have some cross-cutting actions regarding public-private partnerships and communication throughout the strategic orientation. Now, in the next 5 minutes, which are left in this first session, we had a question from one online participant. He asked, in this analysis, were allied health education and rehabilitation considered? I will just ask Dr. Rampati from the Ministry of Health to reply to this one.
Thank you. Okay, to answer this question, health and education, I think Mr. Boulay explained very explicitly where we need to go. And you rightly mentioned that if you want to build the next level of medical tourism, we're still in infancy period right now. And to build that, we have the prerequisite of higher education. And as teaching hospital, flag teaching hospital is coming up, we need to really, I think my DG also mentioned some time back, that we need to have a local people to be part of that system. It's not possible that we get everything from outside. We have enough of expertise in Mauritius, which has developed over years. We need, of course, to have a partnership with other countries to help us in the process of know-how building and teaching hospital. But we want our people, we need a state medical college by the people, for the people. And I think that's the key point. If we can do that, the rest will follow automatically. Medical tourism cannot be built without super specialization. That's point number one. And then the second question of rehabilitation. There are 4 components of healthcare. One is prevention, promotion, cure, and rehabilitation. The poorest baby in health sector is rehabilitation. Just imagine the scope of rehabilitation. We have diabetes, we have diabetic foot. We have stroke patient, bedridden patient. We need rehabilitation. We want to have people with surgery, arthritis, they have plasters in the limb, they need rehabilitation. Geriatric people, they're frail people. They also have osteoarthritis. They need rehabilitation. So this is one sector which has remained a baby in our sector. I'm honest to say that. I've lived this 30 years in Ministry of Health, and we can develop this area, not only for the service purpose, but also the business element. If you develop that, there are hardly any, I know of only one private person who does rehabilitation, but rehabilitation is a real scope if you want to really build business around it. And I hope I've answered your question. Okay, thank you.
Thank you, Dr. Rampati. I think they are telling me that tea is ready. So we'll just take a break of 15 minutes and then we'll come back for the panel discussions, which is going to be moderated by Dr. Ori, Director General Health Services from the Ministry of Health and Wellness. So let us just go for a break and come back in 15 minutes. Thank you.
Test 1, 2. Un, deux, test.
Okay, good morning, everybody. So we start this morning session, a sectoral discussion on health and wellness innovation. First of all, I present myself. I am Dr. Bouchandori, Director General Health Services, and I am working in the administration since the past 12 years. And we are making health policy decision at the Ministry of Health and Wellness. Before I go in here, I will be the moderator for this morning session. And together with me, there are 6 panelists who are experts in their own domain. And I now invite them to present themselves. So first of all, on my right.
Good morning, everybody. I'm Olivier Schmidt. I'm the Chief Operating Officer of IBL Life, called now Life Together, part of IBL Group.
Thank you. Good morning. I'm Dr. Rampati. I'm a Director of Health Services, Primary Healthcare at the Ministry of Health.
Good morning. I am Régine Rousier, Medical Doctor, and I am CEO of CAP Research, CRO in Mauritius.
On your left.
Yeah, on my left.
Good morning. I'm Yannick Lincoln. I'm a director of the High Performance Center of Mauritius, based in Côte d'Or and ruled by the MMIL.
Hello, I'm Dr. Siddiq Modabukas, doctor in medicine, but trained in acupuncture, alternative medicine, complementary medicine, and now called integrative medicine. I've developed a wellness clinic in Mauritius, which deals with physical and mental rehabilitation, Les Marianne Wellness Sanctuary. Thank you.
Good morning. My name is Michel Abetoul. I'm a medical doctor too, and my background is in medical research, essentially with the pharmaceutical industry worldwide.
So this morning, there were a few presentations, and in that presentation, a broad overview of what we will be doing this morning has already been presented to you. Nonetheless, we've got, just to remind you, there are 4 strategic orientation on which we will be working, and has already been worked out and has been already been presented, but we're going to build up on that. And these 4 strategic orientation are first, promoting innovative technology and practices. The second one is harnessing the potential contribution of new field of health and wellness to economic growth. The third, innovating for a healthier population. And fourth is innovating governance mechanism to improve delivery of institutions. And we have also elaborated 10 opportunities in the health sector, and which are as follows: clinical research, manufacture of medical devices, nutraceutical industry, high value activities, including high medicine and telemedicine, wellness tourism, silver economy, medical education, developing a sports innovation ecosystem, Ayurveda and other traditional medicines, addressing NCDs and infectious diseases, life sciences, including pharmaceuticals and vaccine development. So having just presented you about the priority areas and the 4 strategic direction, now I will invite Mr. Olivier Schmidt and Dr. Rampati for their intervention. So, Mr.
You want to start? So I should start. My view, I mean, I was not part of the group, so I've been invited to challenge and give my opinion on the report. So first of all, it's really extensive, and I've seen that you spent like few sessions to come to that report. So congratulations to the members, because it's quite extensive. My first comment is we are mainly talking about a people-to-people industry. And one other thing that strike me, so listen to my accent, I'm French, so I'm comparing sometimes with France, sorry. one of the things that is key is people caring for people, meaning the medical staff and the training. This is key. Like in many countries, there is something to be done on the training for nurses or paramedical and doctors. But more than that, there is a mindset to evolve, because one of the things that is preventing specialist doctor, Mauritian returning doctors to coming back to Mauritius is the teamwork that is not really in place in the medical sector. They like to be reassured that they can work as a team, as a doctor or as a paramedic, because I've been trained that way abroad. So one of the key success factors to me is to unlock and to improve on this teamwork, multidisciplinary team, whatever you call it. So it's really important to me that we as a group, if we'd like to make progress, we can't make progress by ourselves alone. So we need to find a way to promote this teamwork across the board, meaning between, inside, let's say, hospital, between hospital and between private and public institutions, as it has been explained earlier. So this is my first comment. Second comment on e-health. France has struggled over the last 20 years with medical data file, patient data file. One of the things that is complex is the standards of communication between all the systems, and giving the reassurance to the doctors that the data are confidential. By the way, the data belongs to the patient, not to the doctors. So once again, technically speaking, we have to make sure that there are ways of communicating between the system. Last but not least, if we'd like to be very aware of what are the key illnesses and how we treat the patient and what are the progress, we have to be more precise in terms of data collection. So the e-health will help. But let's say there are international tables like ICD-10, which describe illnesses and medical condition. I have 4 years of experience in Mauritius. To be honest, I'm not sure we are properly coding the medical illnesses in Mauritius. Consequently, it's difficult to be very precise in the way we treat or we diagnose and treat patients, or we prevent as well. So on this particular field, I guess the regulator has a role to play by giving a license and forcing even the private institution to be more accurate, reactive, whatever you want, on this medical data, which are key to know what we are doing, basically. So these are my 3 comments regarding the report, and I pass the message on the mic to you.
Thank you, Mr. Olivier. Thank you, MRIC, for giving me this opportunity to be in the panelists and to express my dream to the audience. I would like to congratulate my friend who has worked so hard on this strategy planning. It has been very difficult, believe me. We have worked for so many sessions to put it so concisely. I am very happy for you for that. My passion is about medical education, medical tourism, and energy saving strategy. That's my passion about it, and I think you have rightly mentioned it all through. Basically, I want to sell the dream to the audience that we want to go to the next level of medical tourism. I feel that health sector has a bright future tomorrow, and it can be the pillar of our economy, the next pillar of economy after ocean economy. So how we develop that, this is my passion. I've been dreaming over this for the last 30 years. It's a time given to me to get it done. So hopefully you have taken it on board and we'll do it properly. So the audience have to give their input, how we go to the next level. As I rightly mentioned earlier, that to have medical tourism, we need to have super specialists. And for super specialists, we need to have higher medical education. So this is my area of concern, and I will leave the floor at this moment, and hopefully that to make the dream become a reality be through the participation of the audience who can give inputs. I have already my plan in my mind, but that's not the point. But when you put everything together, probably you get a better plan. So I leave the floor to my colleague to express.
Thank you. So, I think MOIC has taken this very noble initiative because we will be putting in place, developing the framework for many things to come ahead. Nonetheless, before we go any further, it's good for me to mention a few things. First and foremost, the government is very much aware and promoting Mauritius as an innovating country. There are certain things that we are already having. We, as a small island, we are unique by the composition of our population. It is a multiracial, multilingual country. And also, we've got the tourist, a good tourist industry. And when we say good tourist industry, it means that beside our own population, we are already welcoming almost 1 million. Obviously, COVID, we're not talking for COVID. In a normal situation, we're welcoming more than 1 million tourists every year. And obviously, it caters very well in our wellness industry, as well as for our tourist industry, where we can improve our healthcare system in all its aspects so as to cater for them. Also, taking into consideration that when we are having a tourist industry, the tourist industry, although they're very much interested with our beaches, are interested with our weather, they are also interested in the well-being. And this is where wellness comes in. And it is a golden opportunity for us to define what sort of wellness industry we want to develop, and what sort of new branches of medicine that we can develop that will attract our tourists to make further use of those new services that we can offer. We have been doing many things, but it is not being, valorized. Because we've got Dr. Modabaka, she's having a wellness center. There are many spa centers all around the island. There are many spa centers all around the island, but do we have the real human resource requirement to give a high level of such care? Ayurvedic medicine, we are practicing Ayurvedic medicine almost in the past 15 years, but are we able to provide the quality of care for the Ayurvedic medicine? We have seen that we have got our own indigenous products, plants in our country. We've got a whole oceans at our disposal, and all the products that are directly related or indirectly related to the well-being of people, are we harnessing them? Are we trying to do research? Are we trying to put them in its true perspective? And how do we do that? We do that by research, or our research facilities, or people really geared toward those research so as to bring forward products that are good for people. Now, before I go any further, now I would wish to invite Dr. Modabakas, one of our panelists, to talk of us about
it. Thank you. I welcome all of you here, and this is a beautiful opportunity to share our experience in the field of wellness and health, and how we can make something beautiful for Mauritius in the years to come. I have had the chance to develop a wellness clinic in Mauritius. We could have a little 2-minute video. We'll show you a bit the quality of what we have developed. It's in the mountains near Long Mountain, and it's amidst pineapple fields. So everywhere is pineapple field. It's luxurious vegetation. And our logo itself is a pineapple with different colors to reflect the chakra of the human body. And all over it's ginger, pineapple, etc. And we have developed 25 rooms with a design which blends nature and gives emphasis to the nature all around. At the same time, we have developed various therapies which blend Eastern medicine like yoga, Ayurveda, Chinese medicine with Western medicine based on solid medical knowledge, so that we can deliver physical and mental rehabilitation services. Physical rehabilitation is for people who have gone into accidents, for instance. And mental is for drug addiction, mostly alcohol addiction. And our staff are yoga therapists, physiotherapists, osteopaths, doctors, psychologists, counselors in the field of addiction. And also we have people who are coaches for positive living, lifestyle management. So that when someone comes and stay with us, he gets an input from all these specialists who can enhance his lifestyle, his mental attitude, and also his physical health. So what we are doing is mainly a typical example of what medical tourism can be, using natural therapies, proven systems of medicine like Ayurveda, Unani, Chinese medicine, and also added to Western medicine. But the beauty of all this is that Mauritius has got a beautiful atmosphere, luminosity, and also we have the people who have been working in hospitality who are excellent in what they do. And it's a matter of blending hospitality with medicine, but not in the way that people think that this is one square. We are doing very well in hospitality, wellness, tourism. So let's add this to medical treatments and we'll get medical tourism. This is not the formula. The formula is to address each person as one unique individual who comes to you and feels connected to the doctors, feels connected to the nursing staff, to the healthcare staff, and they feel that they're not in number who have come into room 241, room 242, etc. They feel that, you know, the people are centered, the professionals are centered, are turning around them, and they are the center of the attention of everybody. This is what medical tourism is about. It's about somebody who is traveling, leaving their country, coming to us and looking for ways to enhance his health, whether it's physical or mental, emotional, spiritual. So this is the beauty of medical tourism. It's not something that we can mass produce because the quality will fall down. So it's a matter of focusing first on quality. What do we deliver? What are we delivering? How have we trained our staff? This is the most important. I spent about 1 month every year training my staff intensively about communication, talking to people, you know, and everyone who comes from overseas, 50% of our guests are from overseas, except during COVID. And these people come, they take the plane and they send 1 email or 2 emails. They say, I've lost my husband recently. I've had a car accident and I am now addicted to alcohol. Can you help me? This is the type of profile of people we're getting. So this is multi-symptoms, big problems, emotional and physical. And we say, okay, you come over, we suggest 3 weeks or a month. And during that month, we have to do everything to get that person mentally corrected, mentally uplifted. We have got to go into the counseling, the psychotherapy. We have got to do the physical rehab with physiotherapy, acupuncture, Ayurveda, massage therapy. So it's a complete system of approach, which is an integrative approach to medicine. Wellness tourism, when we are looking at the non-technical high end, which is the operations, the robotic surgery, the genetic intervention, etc., the wellness that Mauritius is built for is this type of wellness. Because India has got the Ayurveda, they're doing very well. But people, when they go to India, they love everything about India. You know, they will walk in the mud, they will do everything, they will eat food on the street. They love the Indian culture, the Indian way of life. But people who come to Mauritius are looking for something which is Mauritian, which is different. So we should not copy. We should not copy and paste and say it will work. You know, it may be commercially, it may work, but the people will not have the satisfaction. Human beings nowadays, when you travel all over the world, you will see where the people have enough money, the next priority is health. I want to live longer. I want to live better. I want to be a happy person. In this room, there are maybe 100 people, possibly, I hope so, 50% have got healthy profile, blood profile, lab test, everything is healthy. But can you say you're well? Okay, this is what we are addressing. The wellness is about a state of feeling your own fulfillment. This is a mind, body, spirit connection. Okay, and when we are moving ahead and you go to Europe and all these places, you see people who are so well educated, they have everything, and they talk only about health and spiritual elevation and the search for happiness, because happiness has become very elusive. In the midst of abundance, we have lost the happiness. We have lost the connection. Mauritius is the beautiful place. For me, it's not even a laboratory. It's a God-sent paradise where we can invite people to discover themselves. We can invite people for the journey of a lifetime. If I were to use in the tourism field a logo for Mauritius, you know, it would be Mauritius, une histoire d'amour, you know, because this is where you come back again. You have so many repeat tourists who come back for 14 years. Here in Mauritius, I was doctor for many hotels for 20 years. And you see these people come back and they know all the waiters and ask them, how are your kids? How are they doing, etc., etc. They want to feel connected. We have lost the connection, the human connection, because we have become hyper-connected digitally. And we have lost the human connection. Mauritius is the cachet, is the signature to make something which is absolutely beautiful, absolutely perfect. Each of my guests, I give them attention. They come from overseas, we get them at the airport, we bring them to our place. There's always the human touch. The driver talks to him on the way. And when he brings the guy to my place, the driver gives me a feedback. Tells me this guy was drinking on the road, alcohol, and then he threw his bottle before he came to the clinic, you know? So you get an idea what is the demons that are following these people who are looking for help. Medical tourism, wellness tourism is a beautiful field, but we have to do it properly. If we do it commercially, we will succeed and fail, and it will come back to us in a very bad way. We have to do something, and in Mauritius, everybody is really a person who can approach this wellness tourism in a very positive way, because we like to help. It is in our nature to help. It is in our nature to care for others. You know, I've been to places before I set up Le Marianne, to Germany, to Austria, to Hungary. I've been to many of these spas, etc. But I felt the human connection wasn't there, you know. And then 6 months of the year, it's very cold, it's snowy outside, so you cannot relax, you cannot move around. Mauritius has the climate. We don't have malaria carrying mosquitoes. We don't have dangerous animals. It's a lovely place. The climate is good. The security is good. If you come from Johannesburg, you know what I'm talking. Security is good. We feel all right. Everyone is interested to help, but we must raise the health index of the population so that people are aware of health factors, of food, etc., health factors. It's wrong to go into a spa and you get a therapist to do your massage and he's overweight. Something is wrong. Okay, so for Mauritius, we have to do the medical wellness. The wellness must be outside in our population. Labeling of food stuff, sugar contents, controlling diabetes. Be aware of what you are eating, which is the most important thing, and move. Eat and move. This is what we have to do. Sleep will come naturally then. So this is my view of what we can do for Mauritius. I've got a beautiful vision of what can be done for Mauritius, because we are a hospitable nation. And from my experience at Le Marianne for the past 10 years, I've dealt with all sorts of people, nationalities. I've dealt with royalty, with film stars, with musicians, with celebrities, politicians, but they all are seeking peace of mind, health, longevity. This is what we are about. And this is what Mauritius is for. Thank you very much.
Thank you very much, Dr. Muravakas. You have given us a very good expose of what wellness in relation, in the perspective, in the Mauritian perspective should be. And it's really very welcoming, and hope many of us here who are listening to Dr. Muravakas will try to emulate the success that he is having. And it's true, whatever he has said. Now I invite Mr. Lincoln for his delivery. Thank you.
Merci. If it doesn't bother you, I will maybe speak in French. Ouais, moi c'est un peu mieux. Je pense que ce sera un peu plus fluent. Alors, avant de commencer mon petit mini exposé de 3 minutes, juste un petit sondage. Combien d'entre vous, là, dans la salle, aimeraient perdre du poids? Ouais, pas mal. Ouais, d'accord. Combien d'entre vous, de ceux qui ont levé la main, ont mangé des samoussas tout à l'heure là, au café? Ouais. Et combien ont essayé des régimes? Ouais. Ça a marché? Non. Non, 100% des régimes ne marchent pas. Alors, effectivement, on part de ce constat relativement triste à Maurice, où au niveau culturel, nous sommes assez riches à tous les niveaux, notamment au niveau de la cuisine. Et malheureusement, je crois qu'on a retenu le plus mauvais de toutes les cultures dans notre cuisine. Le plus mauvais au niveau de la santé et au niveau de la façon de cuire, et notamment au niveau des aliments. Et ça se retranscrit forcément à tous les niveaux, à tous les étages, à tous les niveaux socio-économiques. Et évidemment, le domaine qui me touche le plus et qui m'a touché sur ces 20 dernières années, étant sportif de haut niveau, c'est forcément les athlètes, où je constate tous les jours les grosses lacunes que nos athlètes ont envers la nutrition. Alors forcément, ils partent avec un gros avantage, c'est que leur dépense calorique journalière est probablement 2, 3, voire 4 fois supérieure à celle de monsieur tout le monde, ou relativement à Maurice, on est sédentaire. Je crois que on est en train de réaliser qu'il faut se mouvoir et que je vois de plus en plus de gens sur le chemin faire leur petit jogging, faire leur petite marche avec des tracksuits, capuches, etc. On se fait transpirer un peu plus. Persuadé que la transpiration, c'est de la graisse fondue. Mais forcément, ce n'est pas le cas, hein, je vous dis toujours. Mais je crois qu'il y a un vrai apprentissage à faire au niveau nutritionnel. Et chez les sportifs, j'aimerais forcément les utiliser, on va dire, un peu comme showcase, et de voir pourquoi finalement est-ce que nous n'y arrivons pas. Je crois que nous sommes la somme de nos petites habitudes qui sont très ancrées au niveau culturel, et c'est relativement complexe à changer. Forcément, il y a une dimension d'apprentissage et de connaissance derrière, au niveau de knowledge, que nous, on va essayer d'implémenter à travers un peu d'innovation au High Performance Center, afin que ces athlètes puissent déjà être informés sur les bons aliments et les mauvais aliments. À quelle quantité de calories, quelles sont les bonnes sources de calories à avoir pour pouvoir produire une performance. Ce n'est pas si simple, ça demande beaucoup d'investigation et ça demande beaucoup de trials and errors. Et je crois qu'au final, si nous voulons que Maurice continue, même poursuit la progression au niveau des résultats, au niveau international, pas seulement régional. C'est vrai qu'on a gagné les Jeux des îles en 2019. C'était super, mais ça reste quand même une compétition au niveau régional. On était meilleurs que les îles voisines qui ont plus ou moins la même culture que nous. Mais si on veut briller au niveau des Jeux olympiques, je crois qu'il y a un vrai changement à établir. Et nous sommes au High Performance Center en train d'établir des connexions avec des projets au niveau du ministère de la Jeunesse et des Sports pour faire progresser tout cela, notamment au niveau nutritionnel. Donc, ça a été un plaisir, en tout cas, avec le MRIC, de pouvoir discuter de tout ça, de mettre tous les sujets, tous les setbacks sur la table pour voir comment faire émerger, en tout cas, un projet qui serait soutenable, où on ne serait pas à faire des régimes et monter d'un seul coup et retomber tout de suite après. Je crois qu'il y a, il y a quand même quelque chose de longitudinal à faire. Et on a prévu de commencer avec les athlètes comme showcase et de pouvoir étendre ça sur le public au fur et à mesure. Il faut savoir, juste pour terminer, qu'il y a probablement l'une des principales connaissances à avoir, c'est de comment se nourrir par rapport à un budget. Alors, les sportifs, bien souvent, viennent de milieux probablement défavorisés. Ils sont persuadés, ça c'est quelque chose on a beaucoup discuté et qui est un a priori que j'ai pu constater, en tout cas autour de la table, où ça coûte forcément cher de bien se nourrir. Et je crois qu'il faut définitivement apprendre à nos sportifs qu'avec un minimum de budget, on peut se nourrir bien mieux que ce qu'on fait aujourd'hui. Merci en tout cas de m'avoir donné la parole.
Thank you, Mr. Lenkel. Now, you know, we are facing lots of challenges in our country in relation to health and wellness, especially in relation to NCD. You know, Mauritius is one of the rarest countries where we have an NCD survey every 5 years, which means that our 6th NCD survey has already been carried out and we are awaiting the result. But I will try to give you a few data based on the NCD survey of 2015. Mauritius is having 21%, the prevalence of diabetes is 21% among adults of 21 to 72 years old, 21%, and pre-diabetes is 19%. So if we add the prevalence of diabetes and pre-diabetes, it comes to around 42% of our population is having something to do with diabetes. 28% of our population, the prevalence of hypertension is 28%. There are 34% of our population who are overweight and 19% are obese. So if we add these two figures, it comes to over 50% of the population of Mauritius is having something to do with their weight. Also, it is good to also mention that we are a very rare country that we are having a cancer registry since the past 30 years. And as per our cancer registry, which tell us about the rate of progression of cancers, we are saying that there has been a gradual progression in the incidence of cancer in Mauritius. And also, when we see all these data, obviously the government, the Ministry of Health has been doing a lot and gradually has been training its health personnel to be able to deal with such a situation. Today, we have got a well multidisciplinary approach to our NCD patient, and we're offering them preventive, curative, as well as to a certain extent, rehabilitative services as well. We are having all the services that are needed to be able to cope with our NCD patient. But what we are lacking, what we don't have any means of measuring whatever we are doing, whether it is being done in the proper direction, whether it is bringing the true results. And this is where research comes in. Because whatever we are doing, it is also a model. It is already a model, the way we are addressing our NCD population. But what is lacking, again, I'm saying, is the research part of it, to audit whatever we are doing, whether we are doing it, whether it is bringing true results. So this is where, clinical research comes in, because it's a vast area, NCD, and more so in Mauritius, because of our multiracial country. It is a golden opportunity to do research on various aspects of NCD, obviously for other as well. But since we're having a population with high prevalence of NCDs, so these are sectors where we need to put in lots of effort so that we can know what we are doing. Obviously, we're also having Ayurvedic now, and we can also use Ayurvedic and use Ayurvedic in our patient and do research whether it is really helping NCD patient with their diseases. So having said so, now I invite Dr. Abiteboul for his intervention. Thank you.
Thank you very much. So Dr. Ampati's passion was about medical education. Mine is about clinical research, right? So we can meet somewhere, I guess. I just wanted to share with you some ideas and give you, let's say, the big picture about the clinical research worldwide and try to stress this really represents a major opportunity for sustainable growth in Mauritius. So I'll just share with you some figures. If I can move on. Sorry, thank you very much. Did you? Yeah, the previous one, sorry. Yeah, this one is good. So this is the worldwide market of clinical research, all the countries. And then you can see well, 6 years ago, it was representing about $22 billion. And as of today, we are above $30 billion. So the growth is 50% over 6 years, which really represents an average growth of 7%. So it's a massive market and it's growing regularly. Thank you. This is an interesting one because here it shows the impact of COVID on that market. You see 2020, there is a little blip downwards, but then it comes back again, 2021, and expectations for this year, 22 is a growth. So we had a blip, but overall, we see the trend is continuous, growing and stable. So this means that even during or right after the time of major pandemics, it's a very resilient type of market. I think this slide is important, showing that this is the split of the clinical research worldwide by geography. The big blue chunk represent America's north US. It's nearly 45%. The blue quarters is Europe, about 30%. The green one is Asia Pac, another 30%. And the slight chunk in violet is 5% represent Africa, Indian Ocean. If you correlate that with the overall population, it really shows there is a massive underrepresentation of the region in clinical research. This has to change. This will change. Okay, so just keep that in mind moving forward. Based on what we said before, so this is the number of clinical trials that have started all around the world in 2020. Those are the last figures available. As that you can see, 25%. So 1 in 4 clinical trial is oncology. So that's a massive research market. We mentioned we have to be soon, we have a large registry that has been available for the past 30 years. Loads of data. We have coming soon, opening soon, a major oncology unit. Clinical research will be part of that, though that's a massive market for expansion, and Mauritius should play a role in that. If we move to the next one, yeah, I just want to stress that those are the growth of the different segments of clinical research. As you can see, the fastest growing, nearly 20% each year, metabolic disease, including diabetes, dyslipidemia, all the metabolic disorder, that's a major segment. As Dr. Uri mentioned before, of nearly 50% of the population in Mauritius has diabetes or pre-diabetic syndrome. This has to be correlated. As we saw also, oncology, it's the largest segment, but it's growing 12 to 15% a year. So in summary, clinical research is a big, fast-growing and sustainable, resilient market. Oncology, diabetes are 2 major segments of that, and Mauritius has major roles to play in that domain. Africa and the region of the ocean, Indian Oceans, is massively underrepresented. So if you bring all that together, that really represents major opportunities moving forward for Mauritius, provided we develop the positive ecosystem around it to foster at the international standards clinical research in that field. And I'll pass over the mic to Dr. Rosier to give, to the chair, to give a little bit.
Okay, thank you, Dr. Rosier.
Bonjour, si vous le permettez, je vais parler en français parce que je suis plus à l'aise pour expliquer en français. Comme je ne suis pas la seule, ça me rassure. Donc, la recherche clinique, qui fait partie des essais thérapeutiques, se divise en plusieurs segments. Donc, il y a la recherche fondamentale initialement, qui est la recherche in vitro. On cherche comment on va trouver un médicament par rapport aux pathologies. Ensuite, quand on l'a trouvé, on va tester chez l'animal comment ça se passe, comment il réagit, si le produit est toxique, si au contraire ça se passe bien. Il peut y avoir des pathologies chez l'animal, donc on peut représenter aussi ces pathologies, voir si ça marche. Quand on a fait tous les tests chez les animaux, on va passer en recherche clinique. La clinique, c'est l'homme. Donc, ça se réalise chez l'homme et c'est très réglementé par toutes les instances internationales, la FDA, l'Union européenne, enfin, c'est très, très réglementé. Donc, il y a 4 phases. 1, 2, 3, 4. Donc, la phase 1, c'est une phase où on recherche la tolérance du produit. On ne va pas commencer tout de suite chez le patient. Donc, on veut voir si cette molécule est bien tolérée. Et pour ça, on prend des volontaires sains. Pourquoi des volontaires sains? Ils ne prennent pas de médicaments. On leur fait un bilan complet pour vérifier qu'ils sont bien sains. Et à partir de ce moment-là, on sait que s'il y a un effet qui arrive, eh bien, c'est dû au produit. Donc, le produit, s'il y a un effet secondaire qui arrive, hop, il passe à la poubelle. Ensuite, on passe à la phase 2. La phase 2, donc, on va rechercher la dose efficace sur les patients. Pour ça, on prend des petits groupes de patients qui ont des doses différentes. Chaque groupe a des doses différentes et cela permet de voir si le produit est bien toléré chez le patient et s'il est efficace. Quand on a pris ces doses efficaces et quand on sait les doses efficaces que l'on va utiliser, on va passer en phase 3. Donc, la phase 1 et la phase 2 se font dans des centres spécialisés. Ce sont des professionnels qui l'organisent parce que c'est assez complexe. La phase 3, donc on choisit les doses qui ont été présélectionnées par la phase 2 et on va aller sur un très, très grand nombre de patients. Ça peut être plusieurs milliers de patients et ça se fait dans le monde entier, aux USA, en Europe, en Asie. Et là, les investigateurs sont les médecins qui vont s'occuper des patients et qui ont été choisis pour leurs compétences dans les services hospitalo-universitaires ou privés, et donc qui vont être responsables de leurs patients. Là aussi, c'est une tâche un petit peu lourde. Souvent, ils sont aidés, mais à la fin, ces analyses vont donner, au bout du compte, est-ce que le produit est efficace? À quelle dose il est efficace? Est-ce qu'on va le mettre sur le marché? Qu'est-ce qu'il donne comme effet secondaire? Est-ce que l'effet secondaire est tolérable par rapport à la pathologie? Est-ce que la pathologie, il vaut mieux la soigner et avoir un petit effet secondaire? Voilà toutes les questions qui se posent. Donc, quand le produit a été accepté, il passe en phase 4, qui est la phase marketing, et qui, là, s'est donné à tout le monde, et ça fait ressortir aussi des effets secondaires. Vous avez tous entendu parler de produits qui ont été retirés du marché parce qu'effectivement, sur 20 000, 100 000, 200 000 personnes qui utilisaient le produit, sortent des effets secondaires qui peuvent être graves et qui n'étaient pas sortis initialement. Donc, la recherche clinique a ses bénéfices. Elle permet aux patients d'accéder à des nouveaux traitements. Tout ce qui est traitement dans un essai thérapeutique et bilan sont entièrement gratuits, sont payés par l'industrie pharmaceutique. Ces bilans permettent d'augmenter la connaissance de la pathologie, puisqu'on fait en général des bilans très poussés et qui permettent de comprendre parfois pourquoi un médicament va marcher chez un tel et qu'il ne va pas marcher chez une autre personne. C'est parce qu'il y a des petites variances biologiques que l'on ne voit pas comme ça, mais que l'on recherche quand on fait des essais cliniques. Ça permet aussi donc d'augmenter le niveau des médecins, de connaissance des médecins et la qualité des soins, parce qu'on va donner moins de traitements, des traitements mieux ciblés, on va mieux cerner les effets secondaires. Et donc, en conclusion, j'ai été quand même un peu vite, mais bon, c'est la synthèse. L'innovation médicale a permis d'augmenter la durée de vie dans la plupart des pays. La recherche clinique favorise tout un développement médical et économique dans les pays qui s'impliquent, puisque lorsqu'on fait de la recherche clinique, les universités aussi sont impliquées, donc il y a des chercheurs qui vont travailler dessus. Ça va développer les laboratoires biologiques, ça va développer la formation d'ingénierie de la santé qui vont aider à travailler dans ces essais cliniques. Il va y avoir des statisticiens, enfin ça développe tout un système. Et donc, Maurice ayant une prédominance sur le diabète et en cancérologie Et moi, je rajoute sur le lupus, Maurice est un pays parmi les pays du monde qui a le plus de lupus, puisque la prévalence est de 1 pour 500 à Maurice contre 1 pour 2000 en Europe. Donc, il y a une carte à jouer aussi pour être reconnu mondialement dans certains domaines thérapeutiques, puisqu'il y a beaucoup à faire. Et je voulais rajouter simplement que ce que les personnes qui ont parlé avant moi ont dit sont tout à fait complémentaires, parce que quand vous êtes malade, certes, vous avez besoin de vous soigner quand vous avez un diabète, avec toutes les complications que cela donne, mais aussi c'est bien d'ajouter tout le bien-être qu'il peut y avoir à côté, et effectivement la nutrition, parce qu'à Maurice, la nutrition, il y a beaucoup à faire dessus. C'est vrai que les petits gâteaux qui sont là sont très agréables, mais ce n'est pas tout ce qu'il y a de mieux. Voilà, je vous remercie beaucoup.
Thank you to all the panelists. Since morning, we have been discussing a lot. We have been given lots of information. We are trying to understand what is happening in the field of health and wellness in Mauritius. We have been talking of clinical research, medical devices, nutraceutical industry, high value activities, including high-tech medicine and telemedicine. So there's so many things we have already talked. And we can see that we are already having many of them in place. Now, there is also this pharmaceutical and vaccine development. As we all know, in the wake of COVID, we have come to know that there is a big demand for pharmaceutical products. And obviously, when there are pandemics, pharmaceutical products become very scarce and difficult to procure. And it has also been found that in the African continent, pharmaceutical companies and vaccine development and vaccine manufacturing is very much on the lower side. And our government is trying to put everything in place so as to encourage pharmaceutical and biotechnological companies to come and set their companies in Mauritius so as to have medicine and vaccine produced in Mauritius, which obviously will be for the local market as well as for export in the African continent. Obviously, we already know that Mauritius is having lots of bilateral treaties and bilateral in Africa, like SADC, COMESA, just name it. We've got AGUA and so many which facilitate trade among different countries. I think what we have talked a lot on all the 10 priority fields where we have to put our energies. But bottom line for all of these, whatever 10 fields that we're talking, is the human part. Until and unless we don't build our capacity, our human resources, until and unless we don't develop our people, at least we don't trigger our people to understand that there are lots of opportunities in the health and wellness industry, we will not be achieving much. But I think this is a right platform for all of us to take stock of what in the future in the health and wellness field, so that we all start developing our human resources and everything, change our mindset for the health and wellness industry. Thank you. Now I leave the floor open, Madam. Yeah.
Please fire them with questions. Lift your hand, introduce yourself, welcome to the mic. You can either target the question to your panelists or just ask the question.
So thank you. So I'm Dr. Chanson from the University of Mauritius, and I would like to share a proposal to move the country to the next level of medical tourism, as mentioned by Dr. Rampati, right? So it refers to innovation by shifting the smoking cessation services from hospitality setting to hospitality ambience. So it would be like attracting people to come to Mauritius to visit as a tourist, to visit the country, but at the same time to benefit from smoking cessation services, which would be undertaken in the wellness and spa of the hotel. And this research work, which emanates from multidisciplinary approach from health and tourism sector, has shown that this concept, this new concept for smoking cessation services to be provided within the hotel sector, the tourism, the hospitality sector, is feasible, because there has been a qualitative study which has been done among the hotel managers and all directors of the various hotels in Mauritius, the hotel and resort spa. And it has been shown that it is feasible, one. And second, the hotel managers in Mauritius, among them we have Mauritians and international persons, have shown that this is really an original idea which does not exist in the world. So we would be Mauritius would have to seize this opportunity to be the first country to implement this concept, because the concept has been published as a book chapter, as an innovative strategy to develop tourism. And at a conference in China on tourism and hospitality, it has received the best poster, the best paper award, because it dealt with how we could attract Chinese tourists to Mauritius, not only to visit the country, but to do smoking cessation, to have smoking cessation services in parallel, because China is a very huge country with a high prevalence of smokers. Last but not least, this project of medical tourism is not only for the tourists. The idea is to serve the employees of the hotels themselves and the Mauritians as in the context of a community service. And this research work has shown that it is not only a means to promote medical tourism, it's going to promote public health, but also sustainable development, because we will contribute to reducing the prevalence of tobacco users, and thus the amount of cigarette butts being discarded in the ocean, in the land pollution, air pollution. And this is in line with the World No Tobacco Day theme for this year, which is about tobacco, a threat to the environment. So I hope you will give due consideration to this proposal. Thank you for your attention.
Yeah, just say a few words. Madam, this is a very, very promising, whatever you have said. I think the MOIC will have to take it and bring it this proposal, because we do have human resource to train the hotel industry how to go about tobacco cessation. So it will be, I don't know, Madam Madhu is here, to be included as a matter of proposal to the government to get human resources. And obviously when we are going to train the hotel industry, the level of training by itself will improve.
Yes.
Now
Chair.
we're just doing it, but we're doing it. Let's say we'll become more professional, and we are going to increase our capacity in providing that sort of service.
Yes.
And obviously, it's a very innovative idea, and I thank you very much, because we are going to take it up to build our own resources so that we can, at the end of the day, service the hotel industry to put such clinic in their health system and in their.
Thank you, Chair. I am pleased to inform you that the framework for the implementation of the concept is also ready.
Yeah, okay.
I'll be happy to contribute
so
to help.
Yeah, thank you very much.
Thank you, Dr. Lan Chongwa. We have been working on this subject for quite some time. And in Mauritius, tobacco is banalized among the population, including the doctors. All right. And I really feel, I think this is one innovative idea which needs to be put on our table. And it's really new. And you said China, I think the highest consumption of tobacco is there. And the Western world is also very getting sensitized in this area, and they don't have the service available. It may look a very simple and easy segment, but to add the cerise sur le gâteau, to make that tourism become more appealing and more visible, probably this single thing can make the whole of difference. I'm very appreciative by what you're saying, and I'm sure it will help not only foreign, but it will take us, our local people as well, to get sensitized in this area to get this quit habit. Thank you.
morning, everyone. I'm Vidushini again from the Center for Biomedical and Biomaterial Research, which is a center at the University of Mauritius. I would like to make, well, first of all, I'm really appreciative of the technical committee's recommendations or expected outcomes, and thank you for the reflections made by the panelists today. And I would like to add or make an observation and some contribution to the strategic orientations that have been proposed this morning. So my first observation for the strategic orientation 2, I see a lot of emphasis being laid on Ayurvedic medicine, which I'm really appreciative of again. But I think it's high time that we focus a little bit on our traditional medicine. How can we really bring evidence to their safety and efficacy? This, I haven't seen it in the strategic orientation. And as we all know, we are a melting pot. We come from different parts of the world. Our ancestors come from different parts of the world. So we have different traditional medicine here, which have been adapted to the agriculture that we have. So I think it is very important that we also lay emphasis on the medicinal benefits that can be imparted by our endemic flora and fauna. So this is one suggestion for the strategic orientation 2. And my second point is on the strategic orientation 4, where there is a clear motivation to move from research to commercialization. Well, I've been in research for quite some time now, more than 15 years in the field of nutraceuticals, medicinal plants, functional food, etc. I know that we do not really have the enabling landscape to move towards commercialization, but over the time, there is a lot that is being done. Nevertheless, I would like to propose that we need something firm about integrating the biotechnology aspect for the sustainable production of materials that we are going to use for commercialization. So for example, I work with plants. So this is not, I do not have a definite source for biomolecules or extracts, etc. So I think the platform for biotechnological production has to be taken care of in the strategic orientation. And I think also there is a need to include the nanotechnology aspect of things. We do have some good platforms for nanotechnology, but this can be applied to pharmaceutical and nutraceuticals. And then also a very important aspect on the conservation of the fauna, of the flora, since we are talking about commercialization. Then with regards to the education sector, I think it's very important that there is a boost for not only degree in medicine, but also in pharmacy, especially in pharmaceutical biotechnology. I think this is important if the government wants to move on with nutraceutical and pharmaceutical industry. So we need that capacity building. So that's all from my side. Thank you very much.
May I just highlight a few things? Very interesting, whatever you have said. But when we go through the priority fields, we've got the nutraceutical industry, which my friend is a pioneer, I think, in nutraceutical industry. And Ayurvedic as well has been mentioned as its own entity. Obviously, again, the MIC will put in place, they will suggest and make lots of recommendation in relation to nutraceutical industry, because there's that what Mauritius has a Nagoya convention, or so all these things has to be taken care of, and whatever Madam has just enumerated, these are very pertinent issues. Obviously, we have to build lots of capacities. So this is a forum where we have to develop all the human resources that are required for our coming future, to develop all whatever is being voiced out at this point. Thank you.
So thank you, Vidushi, for your question. I think we are kind of on the same line on this topic, you know, on strategic orientation too. We put a thematic on developing the nutraceutical sector. We did not put everything on the slide, but of course in the report, maybe we can elaborate a bit more. And also on strategic orientation 4, there was something as well on the legal framework. So for me, I want to say that there's two major things that are blocking the development of a nutraceutical industry. And that's why also in the strategic orientation, we put quite something on Ayurvedic, because Ayurvedic medicine, medicinal plant from India, they are already very well known. You know, we know the toxicology effects, safety, etc. They are used for 100 years ago. So we know very well the effects of the plant. And the challenge now in Mauritius, as you say, we want to work on plants that are more specific, endemic, or indigenous to the region. But the problem is that there's no local pharmacopoeia. So where you come with a product, it's the ministry, so the pharmacy board, who have to accept it for commercialization. And we are somehow blocked because there has not been maybe enough research, or the research that has been done is maybe not yet recognized. So that's a first point. And then indeed, there's a Nagoya Protocol, which is a major issue as well. You know it as well as me, that it's a protocol where Mauritius is a signatory, but it has not been yet implemented, domesticated in the legal framework, which make it very difficult now if you work on endemic and genetic resource to commercialize it. Today, you can have permit to do research, but not commercialization. So for me, the major point here to unlock this industry, it's on the legal side with the authorities, so the Ministry of Health, the Pharmacy Board, to really put a clear legal framework that would allow not only researchers, but the private sector to work on it. That's it.
Hello, my name is Ricardo Godinez. I represent Africa Rice Project. I'm a lead consultant. And I have two questions. One question for the whole panel is, what is required in Mauritius to become a world-class biopharmaceutical ecosystem? And the second question is about investment sector. What is required also to attract investors, but also to activate venture capital, angel investment groups, and so on within Mauritius? Thank you.
I would like to answer to one of my colleagues who mentioned a few things about laboratory testing. I think Ayurvedic medicine, nutraceuticals, and even clinical medicine need one thing. If all the three put together, we need a lab to test our drugs that we are bringing in Mauritius for our hospital, and that lab will also help the Ayurvedic medicine segment. This is one gray area where people not feel confident because there is not much of research documents about the product they're going to use. So that will help that. And nutraceutical also, you will need the same lab. So if you put all the three in one, we need a lab. Okay, yeah. We need a lab to test these specific things. Okay, yeah. So the second thing is you said communication, right, earlier. And I think the platform that we have here, we need to have a network system put in place so that we can keep on sharing what we have been discussing and keep on discussing.
just 1 minute, I will answer your question. I'll say something about the nutraceutical industry. Right now, we are in the phase of revamping the Pharmacy Act. We're going to replace it with a medical and medicinal bill that is going to come up. And there are different components in that. And one of the components, I think, where we have to include nutraceutical products. So it is a right platform for us to understand that it's time when we are about to revamp the Pharmacy Act to include nutraceutical products. And I think here we need some advice from you, from the MOIC, to include it as a matter of urgency, so as we are able to transmit that part to our consultant who is working on the pharmacy, changing this. Now, talking about, what I gather, what we are all discussing here is to bring Mauritius to another level of where we've got innovation, we've got research, we're bringing our health and wellness industry, to put it at an industry level and bring it at a higher level so that we generate income. And for the country, it's not only generate income, the generation of income, it's part of it, but also for the well-being, for providing a high quality health service and wellness to the population. So obviously we have to, all the educational institution, the University of Mauritius, we're having almost 3-4 universities now. Everyone will have to be geared toward producing our human resources that will be part of whatever we are discussing today. If we are not having biomedical engineers, if we're not having software engineers to produce software, today when we are talking of medical device needs software, needs the mechanical part of it, but also needs software. So we need to develop our students, our university graduates, to become software engineer. I don't know, to become, so we have to build biomedical engineers and mechanical engineers, software engineers, so as to develop a very strong medical device industry. The government is providing lots of incentive, low interest rate. What I gather, there are lots of incentive that the Ministry of Finance is providing for innovators. Now the pharmaceutical industry, biomedical industry, these are innovators. So they are being provided lots of incentive. As innovators, probably you're going to get some tax rebate, as well as loan from the bank. So, and obviously, anybody who wants to build a pharmaceutical company, they will be availing of the different SADC, COMESA, AGWA. We've got bilateral relations with China, with India. Recently, there was an agreement between Mauritius and India whereby the Indian government agreed to purchase, I don't know how many products produced in Mauritius. So as far as pharmaceutical industry is concerned, there are a whole lot of series of measures that are there for innovators to avail of. Thank you.
Just to add on, I think you raised a very good question, very basic, but fundamental question. How do you attract investors? So I think you need a mixture of things, as mentioned before. I think the financial incentives are here. Now, what you really need is a quality system in place, such as GMP, ISO, etc. Quality trained staff and professionals. You mentioned that before, but I think still need to grow a little bit from practical habits. People need to work in the sector. You don't become a vaccine producer from scratch. You need steps to get there. The international recognition system is more or less in place. International trade agreements, which have been mentioned, I think that's very important. And I think the fourth component is economic stability, which is very important for long-term investment, which I think is probably one of the strengths of Mauritius if you compare with Africa in general. So it's a mixture, it's a mixed picture, but there are already a lot of positive components in place. I think the quality segment is where we need to invest a bit more in terms of training, habit, environment, the quality GMP environment.
Thank you.
I've got a question. I'm a sports scientist at Côte d'Or. I also have experience in the health sector in South Africa, One of the thematics spoke about sensitization. I'd like to know, how do you measure and monitor sensitization around non-communicable disease and poor diet? I've seen adverts on TV and on radio, but is anyone tracking and monitoring the sort of penetration of the message? And how do you plan to, measure, and what outcomes do you see for measurement of sensitization?
Yeah. I've mentioned earlier that Mauritius is one of the rare countries where we have our NCD survey that is conducted every 5 years. And the NCD survey is conducted by world-renowned diabetologists, Professor Chimiloto, Zimet, which are and they conduct the survey together with our people. Mauritius over the years have been able to develop a very strong NCD and health promotion unit. This unit does health education, sensitization, screening activities in the community as well as at site of work. Every year, around 50,000 people are screened for NCDs, and around 45 school-going secondary school students are being screened for NCDs. We also have our school health program where we do screen for obesity or whatever, NCDs for school-going children. Now, previously we were screening the population at large, but gradually, because we have already captured most of the people who are diabetics somehow or the other, now when we do our screening, it is tailor-made. Like, we don't screen those people they might be pre-diabetic, known diabetes, they are not supposed to come. We diagnose only people who are not, known to be diabetic or pre-diabetic. So in such a way, we're improving our way of screening and health promotion. And obviously, whenever we do screening, there are lots of activities that goes together with that. There is the nutritionist who exhibit their stand and exhibit food exhibition, what is the breakfast, what should be composed of, what is the lunch, what is they do give some advice on nutrition. Also, we have been carrying out lots of activities in the community. Recently, we had workshop for housewife. The workshop was meant to educate housewife how to buy healthy product for their family. We are also having other program in the community whereby we go, it is run by the MBC. We go to the community and do those type of sensitization. Oh, yes. So we do. What is lacking now? We need to measure how well these are penetrating into the population. Obviously, this is where our research has to become part and parcel of the Ministry of Health, so that whatever we are doing, it is based on evidence, and evidence means research. We have to do research. We have to do to know whether take a sample of population and see whatever we are doing to them, whether they are putting it in, whether they're practicing it, whether they have understood it. So I can tell you, we are doing a lot in terms of sensitization in relation to NCDs, but we lack that part, as you have just mentioned, what we are doing, how we know that it is working. It's just saying, but we haven't measured it, so I won't be able to answer the second part of the question.
Okay. To answer part of your question, I think nowadays, if you use artificial intelligence and everyone has a mobile phone, I think if we develop apps, for instance, to monitor diabetes and help people to manage their diet, etc., this will be a very good thing for Mauritius. And then we have some feedback on what is happening.
and how NCDs are progressing, evolving, etc. And we can get people to get engaged in monitoring their own health. This is the moment someone takes responsibility for their health. This is when the magic happens. If we trust people outside to make posters and say, don't smoke, don't do this, but we are not taking the responsibility, then we are damaging our health. What we have to trigger in the individual is the responsibility for their own health. You see, before we had this education, this communication era, people were in the dark. You know, some people think I'm diabetic because my parents were diabetic, so I'm stuck with that. Others thought they had heart disease because of that. Nowadays, we know the risk factors, and modern medicine is really hanging on the word risk factor. Every one of us has got risk factors. So it's a matter of identifying our personal risk factors, working on them, and try to evolve into good health. Now, the apps that are worldwide on the market everywhere are amazing because it helps you to monitor your diet, what you're eating today, what your HbA1c will be in 2 months' time. You can predict, you can have an idea, you can adjust your hypertension factors. You can adjust so many things just by feedback. You know, we have a system called continuous glucose monitor. It's a little patch you put on your body. There's a tiny, tiny needle goes inside, very tiny. And from your mobile phone, you can monitor your blood sugar level straight away. You know, this is an amazing system. You know, for diabetics, for people on insulin, even for healthy people, you know how much the samosa is raising your blood sugar. You can just eat and test after 30 minutes. You have an idea. So you can design your own diet to know how to keep healthy. I think we are entering into a beautiful phase of artificial intelligence, of apps, whereby each individual now has access to becoming his own doctor or health advisor by feedback. Biofeedback all the time. And this is what counts in the end. Before, when we felt tired and exhausted, maybe our blood sugar was going down, you know, and now you have a way to know exactly what's happening and how to correct it. So the field of nutrition can be really enhanced by using apps, by using systems that are monitoring, giving us the feedback. This is what we want, feedback to improve ourselves. Thank you.
Yeah, I'd like to point out something and coming back to healthcare. When I listen to all of you, most of the segments or topics are related to the rest of the world, clinical research, bioindustry, medical device, whatever. When we talk about healthcare, there is something specific to my opinion is you produce the service locally and you consume the service locally. And one of the things that is lacking in Mauritius, to my opinion, compared to all the other sector, let's say hotel as well, is we are not following any international standards. So according to ourselves, we are good. Sorry, there is something wrong to my opinion. So because it's local, we have to be open to the rest of the world, to my opinion, and look from, I don't know, look for standards that we like to follow step by step, to put pressure on the system, to put pressure to improve, to compare, to benchmark, to demonstrate to the patient that, okay, it's up to a certain level, step by step. And to me, this is one requirement, first to give better trust, to improve the trust of the local population in the health system, and secondly, to attract medical tourists. Because without any external audit or certification, and we can compare with hotels, how we can demonstrate and look at that opportunity to attract medical tourists. I'm talking about health, like acute phase, NCD treatment and all. For some other aspect, more oriented on wellness, perhaps I'm not an expert, perhaps it's a little bit different. But when we talk about acute phase NCD, sorry, we have to put our own like targets based on external standards. Otherwise, we will keep moving in our own like island, saying according to ourselves, we are good. We need to improve the training, the teaching hospital and all, but nevertheless, we have to demonstrate to the local population and to the potential medical tourists that we are to this standard, and then they will have trust in us. Thank you.
Yeah.
excusez-moi, je parle encore en français. Vous avez tout à fait raison. Et nous, pour attirer les Américains qui viennent travailler avec nous, nous avons des audits systématiquement et nous avons été entraînés pour des audits FDA. C'est très dur, ça prend beaucoup de temps, ça vous oblige à faire beaucoup de formation à tout le personnel régulièrement. Mais c'est comme ça qu'on arrive à avoir un niveau et qu'on est toujours en place après 10 ans.
Yeah, just one word. I went through that journey for the last 18 years in other countries, and you're right. Included into the certification, there are evidence-based like protocol indicator, but there are also training obligations. And then it's large like scope of audit or certification, which is right from the processes to the training, to the indicator, and to the information to the patient, and the outcome, the indicator. How many, I don't know, daycare surgery are you, how many surgery are you converting from inpatient to daycare? And you can compare worldwide, because now there are many indicators on that prospect. Thank you.
You have raised a very pertinent issue. This also has to be mentioned in the report. Because, I will tell you, when I was talking about the NCDs, down the lane over the NCDs started all in 1985 in Mauritius, when we took note that we were having a serious problem, and we were among the highest, we were the country with the highest rate of diabetes and all those NCDs. And we have been moving from there, and gradually from scratch in 1985, we have been able to build our structures, build our services, bring in human resources. Just imagine 85 years back, we were not having so many diabetologists, we're not having physicians, we're not having cardiologists, we were not having nephrologists. Now, all these things we are having, now we were not having our NCD itself, our NCD clinics. Specialized NCD clinics are being run in all our 156 primary healthcare points. And now it is being, since the past 3-4 years, we are providing a multidisciplinary approach. So whatever you have said is very pertinent. Now it's the time for us in Mauritius to go in and see whatever we are doing, whether we are doing it right. We have to benchmark it, we have to audit it, we have to continuously improve on the service delivery, because we have built different type of human resources to be able to deal with NCD. For example, diabetic foot care nurse, diabetic eye screeners, we've got diabetologists now, we've got a specialized form in which we do all the profiling of the patient. We do HbA1c every 3 months for every NCD patient. All the patients are being screened for urea, creatinine, cholesterol, everything every 3 months. We have introduced renal risk assessment. We are about to introduce cardiovascular risk assessment. But when we are doing all these things, we have to benchmark it. We have to know whether it is producing results. If we have put renal risk assessment, and at the end of the day, after 1 year, we see the rate of of renal patient increasing. So obviously there is something wrong. So we don't have that mechanism. So this is where all our people working in the health sector will have to become a research worker in his own field. When we say research worker, it's not something too elaborate as if basic research to provide us with data, to compare the data down the lane, to know how things are moving, whether we're moving in the same direction. Like I've just mentioned, we in Mauritius, we are having tobacco cessation clinic. In the same vein, our NCD, the way we deal our NCD, it may be a model in the world, but how do we know about that? We have to go and see our processes, whether we are doing it in the right way, whether it is producing result, whether it is as per international standard, our protocol for treatment, whether it's as per based on international standards. So all these things have to be taken, a new way of going forward to develop our services. And here it is also people from the region can come and get their NCD treated and get advice from us how to go forward. And we are about to introduce physical activity and prescription of physical activity in our NCD clinic as a pilot project. It is about to start in 2 weeks' time.
So, Selvina Chemen from the University of Mauritius. My specialty is actually rehabilitation and disability. And it's more of a comment rather than a question, because throughout the discussions, which were very enlightening and very interesting, very little emphasis is laid on disability and rehab. Dr. Ampati at the beginning said that rehabilitation is a baby. I don't quite agree with that statement because we have created, actually, we have educated around 100 graduates from the University of Mauritius already in these past 10 years in the fields of physiotherapy and the fields of occupational therapy. And it's very important that if we are, like Mr. Schmidt has said, that if we are going to provide health for the local population, that aspect of rehab, which is so important and which does not just come at the end of the medical treatment, but also as a prevention, as a preventive aspect, is taken care of right from the start. And that thing, I feel, is really very important to tap on. The second thing I wanted to because the gentleman over here, sports scientist, I'm sorry, I didn't get your name, but you were talking about health education, and Mrs. Jita also said that one of the strategic aspects with respect to innovation was the health education. We are a team of allied health professionals, the University of Mauritius, the Association of Physiotherapists, the Association of Occupational Therapists, the Association of Dietitians, and the Association of Speech Therapists. And we have mounted, and we are currently doing a stroke awareness campaign at a national level without the help from the Ministry of Health, completely backed by our sponsors. We've done education, we've done mass campaigns all around the island. I think maybe some of you must have seen our posters. So we are now embarking on corporate education. We're doing that with Rogers Capital. We are doing medical education because I think, coming back to what Mr. Schmidt was saying, we talk a lot of multidisciplinary in this country. We don't need multidisciplinary. What we need is interdisciplinary and transdisciplinary. So this is one of the things that the campaign is focused on, bringing the medical team and the allied health professionals team together in such a way that the conversation moves from multidisciplinary to interdisciplinary and transdisciplinary. This is the only way we can improve services, actually. And this is the only way we can build a team. And we don't have in that team a hierarchy per se. We don't have a doctor, which is giving orders, who is giving orders. We have everyone on the same level. I, as an OT, I bring my expertise. The doctor brings his expertise, the physio is theirs. The nursing officer brings their expertise, which is quite unique and something that, unfortunately, the medical team does not tap on as to the level that they should actually. So these are the two things that I wanted to focus on. First, the education aspect. I would welcome a state medical and health sciences college. I probably would like that appellation better. We fought at the level of a university to have a faculty of medicine and health sciences, and health sciences are very important. So a state medical and health sciences college would be very welcome. And then, yes, moving from a multidisciplinary approach to health to an interdisciplinary and transdisciplinary approach. Thank you.
Yeah. May I?
Yes.
Yeah. When we are talking of rehabilitation, obviously it means you have raised a very pertinent subject. You know, recently we have set up the Allied Health Professional Council. It's something very positive, I believe, for the country, because now we've got an Allied Health Professional Council, which englobe all whatever you have just said: dietitian, physiotherapists, occupational therapists, pharmacy technician, lab technician, and everything. So already there is a regulatory framework for allied and health professional. Obviously, you know, We are doing lots of things in terms of rehabilitation, but we are not doing it in a true professional way. I will give you why I'm saying so. We have recently been able to build capacity to develop a spine unit. But spine unit is only doctor oriented. What about the other aspect of it? The physio, the occupational therapist, there are so many other things that accompanies a spine unit. So we've got a very efficient spine unit in the Victoria Hospital. Recently, we have got trained orthopedic surgeons who have been trained by Professor Martin from Denmark. And obviously, we've got an orthopedic workshop who are providing all sorts of appliances for disabled people. So also, we are having a dedicated service in the primary healthcare, which is known as community health rehabilitation. Community health rehabilitation. Previously, it was known as community-based rehabilitation. So these are officers who are trained. Specialized training is being given to them so that they go into the community they go to the house of people with disabilities, and they teach them, to show them, they educate them on different aspects, how to deal with the daily activities. For example, you will agree if somebody is bedridden, we have to do passive exercise. The family will have to be empowered to do passive exercise to prevent stiffness, to keep on the tone and everything of the muscles. We have to teach them feeding habits. We have to show them so many other things, how to take care of bed sores. So this is the work of the community-based rehabilitation officers. Obviously, we are having this service in the past 20, 25 years, or more than that. But obviously down the lane, lots of them have retired. So we are reinforcing these services with new skills being provided to them, because the initial program was 25, 30 years back. Now we have developed a new program, a new curriculum for them to be responsive to today's need. So we are doing lots of things in terms of rehabilitation. As you yourself, you have said, you're from the university, you're fully well aware how many physiotherapists, how many occupational therapists are being trained, and where do they go? They go into the community to do the services. So we are doing it, but we have to professionalize it. We have to again understand, do an auditing, again, I'm saying, when I say the word research, it's not necessarily research. We have to do surveys. We have to produce data, whether all the services that we are providing, whether they're bringing results. And this is what is important. We may be having so many services, but what down the lane, it has to produce results. The quality of life of disabled people will have to be improved by all the services that we are offering. And obviously, you know what is happening also? There's so many services, but I am sure nobody knows what are the different services that are being provided by different level of professional. Allied health professional, what are they? Do people understand what are allied health professional? We don't understand. Do we understand how the NCD services are being run in the hospital? We don't know. You see, so there are lots of communication that has to be developed, has to be communicated to the population, so that and also, again and again, this issue is coming, that we have to improve the quality of our human resources that are providing health services to the community. Because baseline, whenever we are saying health and wellness, it's come down to a person, a people. So how we handle that, how we deal with him, how we have the compassion, the passion we have to develop. We have to develop other skills in our health personnel so as to be able to improve the quality of care and service. Sure.
I endorse fully what our colleague at the end said, and I also endorse what Mr. Smith said earlier. We don't have that team spirit. Everything is doctor-centric. And that's true. I fully endorse what you said, and he also said the same thing. I fully endorse this. It is not that we are born like this. The system evolved like this in Mauritius. Now is the time to change, obviously. So if you're interacting, this is where things will happen. So you can rest assured, we have started this process. It is going to take some time. It is not going to happen overnight, but the fact that we're talking about it, probably this will happen. And then you mentioned about pharmacy, something. It's already part in my project, so you don't have to worry about it.
Yes, thank you. I'm Honorable Francois, MP Parliamentary Private Secretary for Rodrigues. I'll just go straight to my point. Thanks for the panels and everything we exchanged this morning. On a general observation, I just want to point out, I haven't heard anything about, we're talking about research and innovation. The question of the impact of climate change in the next 10 or 20 years on human health. We try to look into that. And my second point, also with regards to climate change, of any research, also is there any teaching modules at our institution, health institution, I mean. My second point observation is we got to e-health. I don't know whether it's working here in Mauritius for e-health, and I heard Dr. Olivier mention the sharing of data between institutions. And Mr. Lincoln also mentioned something about our athletes and our bad diet habit. Is there any possibility to record through our e-health system each and every one in our republic, our daily or weekly number of hours we are doing exercise? I heard about being exercise, because we're talking about a healthy nation. If we want to meet the vision of Mauritius as une île sportive or comme une nation en bonne santé, I think there's a question how to relate this data and through e-health. And my last point, there was mentioned somewhere, I think by Dr. Boulay during his expose, the legislative framework for nutritional labeling. I'm quite interested, probably have some discussion after, but because Mr. Lincoln also mentioned about our athletes. Has there been any research about our food in our country that can sort of increase the performance of our athletes? Let's go to, like, I love rugby, our All Blacks. Rodrigues eating maize, local foods. Has there been any research in that direction, but we can increase the performance of our athletes? I'll stop there because we are running out of time, but I'm very thankful to be amongst you this morning and for all the discussion and sharing of ideas and to make Mauritius prosperous, and let's look ahead. Thank you.
You have raised very pertinent issues, Mr. Francisco. When it comes to climate change, obviously, when we talk of climate change in relation to health, what comes to our mind? More heat, more cold. In our context, there will be flooding. So in relation to health, whenever there will be flooding, we'll get drowning. Whenever we are going to have high climate, there might be lots of uneasiness probably in elderly, so we need to educate people whenever there are heat and all the things to hydrate themselves. And whenever we are talking of climate change, obviously, it may be on the higher side or the lower side, but when it is on the higher side, obviously mosquitoes, proliferation of mosquitoes and everything will be higher. But here I have to tell you one thing, that Mauritius is one of the rare countries where we have got a very strong disease surveillance system. When I say disease surveillance system, it's mostly in relation to vector-borne diseases. Mauritius has been declared a malaria-free country since so many decades. And now recently, the other vector-borne diseases that are transmitted by mosquitoes, these are chikungunya and dengue fever. This is also, we don't have any indigenous cases of such diseases. All such free diseases are all imported cases. And because our very good surveillance, public health surveillance system, we're able to capture any imported vector-borne disease in Mauritius in real time, and we're able to cope with it. As far as monitoring of, I will give you this. Now, nutritional labeling of nutrition, we are about to bring about a new, I've forgotten the search, in a new framework, food labeling framework that is coming up. And also e-health. After so many years of trying to put e-health in our health system, we are about to be able to introduce it in the coming 1-2 years. Why? Because it is being sponsored by UNDP. So we are having regular meeting with NDP to develop the project proposal and implementation as well for e-health in our system. I just leave.
I just want to share a story with you to answer your second question on how we can measure or monitor physical activity. 1 year back or 2 years back, I met a couple, a South African couple in an hotel here in Mauritius, and they were explaining me that they were paid a ticket from South Africa to fly to Mauritius for holidays only, because they were compliant to a program run by Discovery. Discovery is a South African insurance. They have a watch, and daily, all the day, they have a program to follow. The watch was ringing. They have to walk. They have to enter data on their watch, how much of calories or whatever they do, activities, food, I don't know. And they were rewarded because they were compliant to that program, and they were paid a ticket to fly to Mauritius for holiday. So it's like Big Brother to me. It's like an ethical issue to be discussed, but technically speaking, to answer your point, it's possible and it's already in place in some area. I don't know if it's relevant and in terms of like confidentiality and ethics, there are a lot of to discuss, but we can do it if we want. It's just a matter of where we put the line to it.
Yes, just to remind, I just got it, that we are about to bring about a food standard agency. The food standard agency is going to look after all aspects of food, the quality, the labeling, all the will control all the food that are being marketed in the country.
I would like to highlight 2 points. Being a teacher, I might not be requiring a mic because we keep addressing like 100 students every time. Ayurveda has multiple times proven its efficacy against most incurable diseases. So as we were discussing about some like evidence-based Ayurveda, so I'm there, I'm a credible source. You can fall back to me and we can have a detailed discussion what evidences you require upon the efficacy of Ayurveda against like various simplest diseases or could be something very incurable. We don't quote any patient, but there was a world news where like one ex-prime minister from Kenya, his daughter got cured of optic nerve atrophy, which cannot be cured. She got her vision back after 6 years of blindness. You know, and also Panchkarma is the message I want to convey to you. Dr. Ori's 6 Ayurveda clinics have got Panchkarma centers, but the doctors are not much trained over Panchkarma. What is Panchkarma? We keep accumulating toxins every time, every minute, every day because of wrong food, stress, GM food, and aging, our genetic makeup. We keep on building up many diseases, many like, and they manifest under microscope much later, and then they almost become incurable. We have to work very hard to have non-communicable diseases.
And we kept on seeing people repeating blood tests, because when they ask for their blood test, they don't get it because it's a property of a different institution. So I am talking about the prevention of complication, because there would be some diseases that we won't be able to do prevention, okay, like type 1. So my solution, our solution, which can be put and used for other conditions as well, is a complex care plan, where it will encourage like multi-agency sectorial participation, cross-sectional participation, but together with the patient. So that is, we've discussed it in the technical committee as well. We've come forward with an app. It's called My Sugar D, which will help people with the carbs count as well. So this would be something, because there are conditions which is so complex. It's not just about doses. It's not just about what to eat. When you get home, it's so complex. So that will be something that we can work together just to avoid people from getting sicker and sicker. Thank you.
Two people from public and private sector to move in effect, especially then announcements, please.
Je prends celui-là. Je vais faire en français, tiens, la conclusion. Vous avez apprécié mon accent français, donc j'en profite. Moi, c'est la première fois que je participe à des assises de l'innovation. Merci de m'avoir invité. Je pense que le mot que je retiens, c'est qu'il faut qu'on ait un petit pays. Il faut qu'on travaille ensemble. Il faut qu'on travaille ensemble. Je compare avec la France, désolé, et c'est pas pour comparer, c'est juste parce que ce que j'ai vu avant Maurice et la France. Il faut qu'on travaille ensemble. C'est possible parce que c'est 1,4 million d'habitants, qu'il y a beaucoup d'acteurs. Il n'y a pas trop de régulation, en tout cas dans le secteur privé, tout le monde veut tout faire. C'est dommage. Il faut qu'on partage des données de manière confidentielle, anonymisée, mais il faut qu'on se fasse confiance aussi. Et il n'y a que comme ça qu'on arrivera à avancer tous ensemble mieux. Ce n'est pas gagné. Il y a pas mal d'historiques et de cultures médicales qui sont en place, qui sont dures. Mais je pense que c'est la seule solution pour avancer, parce que quand on voit comment ça va vite à côté dans les autres pays, si on n'est pas capable de travailler ensemble dans un pays petit comme Maurice où en une demi-heure on peut tous se retrouver, ça va être compliqué. Donc moi, mon souhait, mon vœu, merci d'avoir fait ce forum, je trouve que c'est l'occasion déjà de se connaître, c'est de continuer et d'avoir des occasions de travailler ensemble sur des sujets très pratico-pratiques pour que ce soit effectif, qu'on voit que ça sert à quelque chose et qu'on aboutit à quelque chose. Sinon, on se revoit dans 5 ans, on refait une conférence et on n'aura peut-être pas avancé autant qu'on pourrait. Merci.
Yeah. From my side, you know, this has been a very enlightening forum. Lots of ideas, lots of, in terms of innovation, in terms of research, we have known where we are. We know we have got many things. Now, this is the platform. From here, we have to move to higher level and hope MMRIC will do that part. And we all will be gaining, the country will be gaining from whatever has been discussed here, because they're very pertinent issues that has been raised, and it has to be translated into reality. Thank you.
Thank you, Dr. Obi. Thank you, Mr. Schmidt. Now we have come to the end of the session. We have heard a lot from you participants, from the panelists, from technical committee members. At the level of the MRIC, we are going to update the report as per the recommendations and suggestions made today. And tomorrow we are going to present this report to a wider audience, not only of health professionals, but other professionals who might have some other ideas. We're talking of multidisciplinarity, transdisciplinarity. So we want to hear from others as well. And once the report is ready, we'll have a validation workshop in about 8 weeks before it goes well. And we intend to implement some of the recommendations very quickly. Mr. Schmidt, I don't hope that we are here 5 years later discussing about the same things. We are very keen on making progress on some of the issues that have been raised during the discussions. So on behalf of the council, I would like to thank technical committee members for their hard work since 2 months, to thank our awesome panelists who did a great job today, and to you, dear participants, for your active participation and suggestions. So thank you very much, and we invite you all for lunch where we can have more discussions if you want. Thank you.
Test.